Hey there, Dr. Mamina here. Some of you have had a few questions about your psoriasis and recommended treatments or what products to use to help relieve it. So I'm going to get into managing psoriasis and my top recommended dermatologist tips. Let's start with the basics. What is psoriasis? Well, psoriasis is a chronic skin condition that's characterized by red, scaly patches and plaques on your body. The patches can occur anywhere on the body, but they're most commonly seen on the elbows, the knees, the scalp, and the back. So when diagnosing and treating psoriasis, there are different types that you should be aware of so that you can determine your best treatment option. First, there are different forms of psoriasis based on their appearance or morphology. So there's plaque psoriasis, and that's the most common form, and they appear as raised red plaques covered with this silvery white buildup of dead skin cells, typically found on the torso, elbows, knees, scalp. Another type is guttate psoriasis, and these are actually small red spots scattered throughout the body. Then there's pustular psoriasis, which are white, pus-filled blisters, aka pustules, and these are embedded within inflamed skin throughout the body. We see them a lot on the palms and soles. Then there's various types in terms of the location on the body. So there's scalp psoriasis, which is often red, scaly patches and plaques that can cause a lot of itching. Then there's palmar plantar psoriasis, which occurs on the palms of the hands, the soles of the feet. Another is inverse psoriasis, which is psoriasis that develops in the skin folds like your armpits, your groin, your genitals, under the breast, the belly button, and the buttock area. Interestingly, a pretty common location for psoriasis is found in the nails, which affects about 50% of people with psoriasis. And some patients may only notice nail psoriasis without any other skin finding. Nail psoriasis can lead to various changing in the nails like onycholysis, where there's a separation from the nail and the nail bed. There's also pitting, which are like small little dents or depressions in the nail. And then there's onychodystrophy, which is abnormal or thickened nail growth. Then there's also psoriatic arthritis, and this surprisingly can affect 80% of patients with psoriasis. It can cause inflammation in the joints, leading to pain, stiffness, and swelling. Another surprising thing that we could see in people with psoriatic arthritis is that some people may not even have any skin changes that are representative of psoriasis. They may only just have psoriatic arthritis. I know I just threw a lot of information out there, so I just want to reiterate that the best way to diagnose psoriasis and understand what type you have is by talking with your doctor. That way, you'll be able to understand what might be triggering it and nail down the best solution. And speaking of triggers of psoriasis, let's touch on that real quick. Some of the most common causes of psoriasis are things like stress, skin injury, such as like having a cut or a bad sunburn, infections like a strep throat, there's cold or dry weather, as well as things like heavy tobacco use and drinking. There are also some medications that can trigger psoriasis, things like lithium, prednisone, beta blockers like metoprolol. And then I also get asked often if gluten is a trigger of psoriasis. Now it can be, but not in everyone. Gluten can be a trigger in those who have positive antibodies for celiac disease, and it just ultimately can aggravate your psoriasis. But an important thing that I want to mention is that psoriasis may simply be a signal of another underlying condition. So when you develop psoriasis, it's almost like a canary in the coal mine situation because it can reveal that you're likely experiencing inflammation elsewhere in the body. This internal inflammation can result in conditions like cardiovascular disease, so things like strokes or heart attacks, as well as diabetes, metabolic syndrome, obesity, hypertension, and dyslipidemia or high cholesterol. And this isn't always the case for everyone, but it is definitely important to speak to your doctor and discuss your risk factors for these conditions if you have psoriasis. So although having psoriasis is not fun, it's uncomfortable, it's distressing, it's annoying, I almost look at it as a blessing in disguise because it can be a warning sign that there could be some underlying inflammation. When patients find out that there could be a connection between their psoriasis and some type of underlying condition like cardiovascular disease, it actually can be very empowering, and they learn to take their health more seriously and to do things to avoid developing any of those underlying conditions. Which leads us to the various treatment options available when it comes to managing psoriasis. So there are a ton of topical anti-inflammatory medications that I often recommend to my patients. Things include steroid cream like clobetasol. There's non-steroid creams like vitamin D analogs like calcipotriene. There's also topical retinoids like tazarotene, calcineurin inhibitors like tacrolimus. There are neuromeds like the aryl hydrocarbon receptor agonist like tapinarof, aka Vtama. And another one is the PDE4 inhibitor like roflumilast, aka Zoryve. If you have scalp psoriasis, shampoos with coal tar, as well as ketoconazole, which is an anti-yeast ingredient, and salicylic acid, along with anti-inflammatory prescriptions, can all work really great. Then there's also something called phototherapy, particularly narrowband UVB light, which is a great option. So this is actually a light treatment. It's a UV light treatment, a specific wavelength that targets a specific layer in the skin where the immune cells live. So even though this is just a specific length of UVB, it fortunately does not increase your risk of skin cancer. For more severe cases of psoriasis, some centers offer UVA phototherapy, but unfortunately that can potentially increase the risk of skin cancer. And some people might actually use tanning beds to help their psoriasis. There was a viral video with Kim Kardashian sharing her at-home tanning bed for psoriasis, and this made derms really upset because, first of all, tanning beds, we know, exponentially can increase your risk of skin cancer. And really, she could have just gotten a narrowband UVB light box instead of a tanning bed. Now people think that you have to have a tanning bed to heal psoriasis. Anyways, I digress. And then another treatment route is through systemic therapies, so oral medications or biologic injection medications. Now, when it comes to oral medicines, the ones that are more often prescribed are things like apremilast, aka Otezla. There's also methotrexate, cyclosporin, acitretin, and then there's the new agent, the TYK2 inhibitor deucravacitinib, aka Sotyktu. And then as for injection medications, these are also known as biologics. These can block specific inflammatory markers or pathways that are involved in psoriasis, and they have become more popular in the recent years. The older, more original biologics include things like adalimumab, aka Humira, or etanercept, also known as Enbrel. But now we're using a lot of the newer generation biologics like secukinumab, aka Cosentyx. There's also risankizumab, aka Skyrizi. There's guselkumab, aka Tremfya. We're using these a lot more now because of their improved safety profile and their better efficacy. Biologics, as well as many of the oral medicines, are all technically immune suppressing medications, so they are still not without risk. And then there's treatments beyond medications, like managing your stress with mindfulness, meditation, yoga, journaling, surrounding yourself with positivity and good relationships. And studies have shown that a Mediterranean-based diet specifically has been shown to be helpful for psoriasis. It's also important to minimize things like alcohol consumption as well as smoking. Now, there are a few studies that support some other more natural or holistic approaches to treating psoriasis, and these include omega-3 supplementation, turmeric supplementation, as well as something called topical indigo naturalis. And these have all been shown to help patients manage their symptoms of psoriasis better. When it comes down to it, psoriasis is a systemic disease that requires a comprehensive approach to managing it. By combining medical treatments and lifestyle modifications and holistic approaches, you can effectively control your psoriasis symptoms and improve your quality of life. And when you are treating your psoriasis from a more holistic standpoint, not only are you treating the psoriasis itself, but you're also healing any kind of internal inflammation that could be brewing inside and potentially preventing other chronic inflammatory conditions like cardiovascular disease. I hope you found this video on managing psoriasis helpful. If you enjoyed this video and you want to learn more about holistic skincare, be sure to download my free gift, my top 5 skincare favorites. And remember to hit that like button, share this video with your friends, and subscribe to my channel to start your holistic wellness journey for your mind, body, and skin. Thanks for watching.